Hello, welcome. This is Here's Your Good Health. My name is Linda Prezioso. I'm a nurse practitioner here at Family Medical Center, and I am the owner and operator of the Essential Health Medi-Spa. And I am really excited tonight, y'all. We have got a great guest, a great topic. This is Dr. Connie Smith. She is new to this area, so y'all welcome her if you see her out and about. She is an infectious disease doctor, and I'm really excited about that because there are certain things that they're just really tough to handle, and that's where infectious disease comes in. So welcome, Connie Smith, MD.
Thank you for having me.
Great to have you here, and
Thank
you are
very much.
new. So let's just do a little mini bio. Tell me a little bit about yourself. When did you decide to be a doctor? Where did you go to school? Where did you grow up? That kind of stuff.
So I grew up in West Virginia, and when I went away to college, I majored in pre-pharmacy, and I became a pharmacist. And I finished pharmacy school and practiced as a pharmacist in a small area in Virginia. And I practiced for a year, and during that time I realized that my true love was really to become a physician. So I then went back to medical school after working for a year as a pharmacist, which was a wonderful opportunity, introduction into medicine. So I went back to medical school at West Virginia University and finished my medical training there, and then decided to do internal medicine and pediatrics. So I did a combined residency at Northeast Ohio, up at Cleveland Clinic Akron General and Children's Hospital of Akron. So spent my time there and stayed on an extra year and was chief resident in pediatrics and internal medicine. And then I returned back to West Virginia because I realized that I wanted to specialize in infectious disease. So I came back to WVU and did an infectious disease fellowship. After the fellowship, we relocated back to Virginia, which was very close to where I had grown up in West Virginia. And I joined a multi-subspecialty practice, which was a lot of great opportunities. It was a very busy practice, and I was in that practice for about 8 years, and then branched off and went into practicing just infectious disease. Previously I was practicing both internal medicine and ID, infectious disease, and then I just specialized in only infectious disease, and that's what I've kind of been doing for, I guess it's been 24 years now. I've been practicing infectious disease.
You don't even look like you barely look like you're older than 24, let alone all that behind you. But that's awesome.
It's been a fun time.
Well, see, infectious disease is good to you because you're very young.
Well, thank you.
I know she does have 2 kids in college, so she's maybe not that young, but of course I'm ancient, so anybody's younger than me. Even Noah, I think, is younger than me. But anyway, so what brought you to Rocky Mount?
So we kind of entered this phase, my husband and I, in our life where our children had finished high school and was in college and starting their career path. And we were kind of looking for a change. He actually has a job where he's able to work remotely from home. And we had always liked the Carolinas, and we kind of wanted to change it up and do something different. We'd been in the same place for 20-some years. And so we started looking in the Carolinas, North Carolina, South Carolina, even into the Florida area. And really came across, I think a recruiter had actually pointed me in the direction of Rocky Mount, and I honestly had remembered it from just driving through on the way to the beach or passing through. And then we came and met. The interview was very nice. They set us up to meet a lot of the physicians in the community, and it just felt like a wonderful mix. It kind of felt like home, very similar to where I had grown up in West Virginia and Virginia. So we decided to make the move. So here we are. So I've been here since April.
So you're brand new.
Welcome.
Welcome. It's awesome that you're here.
Thank you.
I've always had an interest in infectious disease myself, and after I worked at Nash for 23 years, and after I got my nurse practitioner, they did not have any full-time nurse practitioner openings at that time. Now they're everywhere. Nurse practitioners are everywhere. But that wasn't the path that I was supposed to take. I was supposed to go to Family Medical, and I've been there 13 years, and I love my job and love my patients. But infectious disease is it's a specialty that I don't think a lot of people know about. They don't realize the importance of it. Maybe just the providers more because they're the ones that get stumped. You know, this antibiotic won't work, this one won't work. It's resistant. What do I do? Dr. Smith, help me. So tell me a little bit about infectious disease. What is it? Why do we have it?
One of the reasons I was drawn to infectious disease is with my background in pharmacy, I really was intrigued by antibiotics and how the different mechanisms of action and why certain ones would work in certain people but not in other individuals. But infectious disease, we see quite a variety of cases. The one thing that's very attractive about the specialty is we see surgical patients, medical patients. You can see from birth all the way up until someone is well into their adult life. But the types of things we see really is kind of head to toe. We see, starting at your head, we see things like infections in the central nervous system, in the brain, so meningitis, which is familiar to some people if they've ever known someone who's had meningitis. So infections in the central nervous system. We see heart infections, cardiac infections. People can have endocarditis where they have heart valves, either their own heart valve or a prosthetic heart valve that becomes infected. We see the more common things like pneumonia. We see skin and soft tissue infections, so cellulitis. Oftentimes people will say, do you see the flesh-eating bacteria? And we do. That's the more severe skin and soft tissue infection, and it's actually more common than you think, so we definitely see that. We see common viral things when people have influenza, and certainly in the last couple of years we've been seeing people with COVID and the complications. So pneumonias, central nervous system infections, cardiac infections, infections of the skin, and then some parasite infections. If people travel to certain parts of the world where there are differing types of infections, we see tuberculosis. So some of the contagious types of things.
Sad that that's on the rise, isn't it? Yeah.
And then finally, we do take care of individuals with sexually transmitted infections, HIV, gonorrhea, chlamydia, syphilis, a lot of those types of problems that have been really escalating throughout the world, but in the United States as well. So it's really no 2 days are ever the same. You can have 20 patients every single day for 30 days in a row and never see the same thing twice. And then it's interesting, different parts of the country where you practice, you'll see different things. We are in an area that has a lot of rural places where people live. They work on farms, the farming industry, and there are some infections that are very much associated with working with animals. So we are the specialty that if you acquire an unusual infection from working with cattle or sheep or things like that, then we are the type of physician who helps to kind of figure that out as well. So yeah, it's quite a variety of things that we see, common things, but also uncommon things.
Right. How common is osteomyelitis? That's infection in the bone. That's always intrigued me.
Yeah.
I don't know why.
It's actually very common. I think we see a lot of that because we have so much diabetes in the United States. And when people have diabetes, it renders their immune system weakened to the extent that they are more susceptible when they have a cut, a scratch, or some kind of disruption of the skin, that what would start out as a small blister on the foot can then lead to a larger blister on the foot, which then can tunnel down into, and the infection can spread to the bone. And oftentimes people will have infection that has gone down to the bone, either in their foot or their arm or from a trauma or something, and it just is not healing. So they'll come to the infectious disease doctor because this wound on my leg is not healing, only to find out that the reason it's not healing is because it's extended down to the bone. So in terms of how common it is, it's actually quite common. We do see it fairly often. Most of the time when we see it, it's from an ongoing smoldering infection that's not fully been appreciated by the patient or the provider or the team of physicians, or maybe the patient had difficulties following up, like maybe they didn't have a ride or didn't have transportation or the means to get the treatment, and the infection can extend rather deeply into the bone. So we do see quite a bit of it.
Oh, unfortunately. Yeah, well,
Yes, we do.
diabetes is so prevalent, which is very unfortunate as well, but It's the reality, that's for sure. Do you work along with the wound care center folks?
I do, and we actually, our office is located at Nash, on the Nash campus. We are just right next door to the wound care center, which is geographically very nice for us. We share so many common patients together, so it makes it nice for the patient to be able to go to the wound care center, and if they need to see us, to come next door. But the two specialties work very well together. Oftentimes with a wound, in fact, most of the time with a wound infection, antibiotics are only half of the treatment. The majority of the treatment is really good wound care. Being able for someone surgically to remove the part of the tissue that is not going to be viable or to be able to survive, and so that you can start out with a nice clean area of tissue. So we do work with the wound care center quite a bit.
Okay, yeah. You know, and I've just noticed in medicine, it seems like when I worked in the ER, it was like, oh, this is a UTI day, or this is a chest pain day, and it tends to be the same. You know, I'll have lots of infections I send to the wound care center, and I don't think I've sent one in a year, which is a good thing.
Interesting, right.
Yeah, it's a good thing. No, I've had them, you know, they were in the hospital and they've already been established with the wound care, and I see them, you know, for their other problems. But yeah, so, but, you know, I think we're really blessed in this small community to have as much great professional care as we do. You know, our heart facility is great. We've got you for infectious disease. And now, are you alone? Do you have nurse practitioner, or?
At the current time, I have one partner, Dr. Kenwar, and I think he has been on the show before. So there are two of us currently, and then we have a team. We have a nurse in our office that is fantastic, and she really is that glue that kind of holds us together. She communicates back and forth with the patient and helps coordinate if they're getting antibiotics. And I always say with infectious disease, the clinic team is very important, because most individuals coming to the infectious disease clinic don't feel well because they're sick, they're getting antibiotics, and a lot of the antibiotics that we do now out in the home setting, years ago, those same individuals would have had to remain in the hospital for that same treatment. So we kind of take for granted that we're sending people home to give themselves treatments that previously we would have done in the hospital, where you have all kinds of support around. So having a clinic staff that is supportive, and a hospital like Nash that supports that clinic, is very important, so that the patient doesn't feel like they're alone at home when they're trying to navigate something new and different with antibiotics. And on top of that, they don't feel well because they're fighting off an infection.
And you can have those, you know, pumps, and they have pumps that are like just will fit your arm, but they're noisy. My ex-husband had one, you know, and you hear this whirring all night long, and it's not conducive to sleep.
It is pretty amazing that what we do at home now with home infusions compared to what we did, you know, many years ago.
And it's great. I mean, it really is much better for the patient to be home in their own.
It's much better for the patient.
Who wants to be in a hospital? There's sick people there.
Sleepy, and you can sort of distract yourself from what's going on at home and kind of feel like you're getting back to normal a little faster, I think.
I think that's great. So it really is, it's a good program. But and then of course you have home health that can go and tend to those things as well. And they do a certain amount of wound care as well, I think.
They do, yes. They provide a nice support for that.
So your office is there on the campus?
We're located right on the campus.
You're not in the hospital, you're on the campus?
On the campus, yes.
Okay, so how do I find you? What do I do? I'm a regular person, and I've got a horrible infection, and my doctor said I should go see somebody. How do I get to you? Does my doctor have to send me, or?
The preferred way is to have your primary care physician, your provider, or if you're at an urgent care or an emergency department and it's felt necessary that you see an infection specialist, that particular provider, the easiest way is to have them to send a referral to our clinic. What happens when that comes into the clinic is the staff takes that referral and they hand it to either myself or my partner. We then will go into whatever medical records we have available to us, such as if you were in the emergency department, we'll go back and look at that, and we review every incoming consult or referral, and determine how quickly that needs to be seen. So if you refer someone to me and I look at it and it's a very critical type of situation where I feel that I need to make a significant intervention with an antibiotic in a short period of time, we try very hard to call you up and get you into the clinic right away. Sometimes we'll receive referrals, and when we go in and we review them, we will find that you may have a particular culture from a urine or from a wound or from your blood that a provider has sent off as part of their workup. The results come back and the provider is uncertain what to do with it because it's an organism they may not be familiar with, or it requires a treatment that they don't have access to. So by reviewing the referral when it comes in, it allows the infectious disease specialist to determine how quickly we need to work you in and have you be seen. And we try to coordinate that. So there's a sense of triaging, so to speak, when those referrals come in. But we do try to, and for a while there was only one physician here at Nash, but now being that there are two of us, we're hoping for that wait time to get in to see us to be shorter.
Right.
So we always strive to make that happen.
Sure.
On occasion, we will review a referral and we'll say the best situation is for the patient to come and be admitted to the hospital at Nash. We then come see you in the hospital and we can initiate the therapy in the hospital, and that gives us time to make sure we have you on the right antibiotic, to work with your insurance company to get approval if we feel that you could do the same treatment at home. So there's a lot of logistic things that sometimes we can't do in the outpatient setting. And so if you are referred and you receive a call back saying Dr. Smith has reviewed your referral and she feels it's best that you go be admitted to the hospital, and then she'll see you in the hospital, that gets you treated faster because I have access into the hospital to get you started on antibiotics right away.
Okay, so that was going to be one of my questions. You go and treat people in the hospital.
We do.
Obviously you do.
About half our day is spent in the clinic and the other half is spent in the hospital. And then we provide services on the weekend as well. So if you're admitted to the hospital, Nash now we have 7 days a week around the clock coverage with infectious disease expertise, which is a nice benefit in a smaller town to have that.
Yes, because
it's nice.
You can never get sick on the weekends.
Exactly. Exactly.
All right, it's time for our first break, and when we come back, we're going to talk about Lyme's disease. I'm really excited to learn all Dr. Smith has got to teach me, because it can be a really devastating, debilitating disease, and it's something that can hang on for years, and so I want to talk to her about that. So we'll be back in just a minute. Don't go away. Hang on.
When Jay arrived at the emergency department with a hernia, he was in pain, scared, and unsure of what would happen next. That's when he met Dr. Clarice Monnier.
The way she conveyed, it was something that I could understand. She didn't talk over my head. She called me at home on her cell phone just to see how I was doing. They really treated me like family. I just can't say enough, and I wouldn't be hesitant to come back here.
Learn more at nashsurgery.com.
We're in our 18th year of practice at the Hammer Chiropractic Center, and we've seen over 15,000 different people in the Rocky Mount area. 40% of headaches actually come from a neck problem. Many patients come in taking multiple aspirin, over-the-counter medications and such a day, and we can get you to stop doing that and actually fix the problem so the headaches don't rise anymore. A lot of people think chiropractic hurts. It does not. Most of the people come in and they feel great when they leave.
When faced with special care needs for elderly or disabled loved ones, families want compassionate, comforting care. That's Tender Touch Home Care Services' goal, providing the level of care we would expect for our own. With over 10 years of home care excellence, Tender Touch provides an array of services that keeps your loved one at home. From personal care, light housekeeping, errands, and meal preparation, to our private duty care program, which combines all of our home care offerings in one package.
Tender Touch Home Care Services, where your needs are our concern.
All right, welcome back. I'm getting educated on vaccines now, so that's a good thing. That's one thing I like about our little breaks. I always get a little extra something when I talk to my guests. So Dr. Smith knows everything there is to know about Lyme's disease, right?
I don't know about that.
So tell us what it is. How do you get it? What the heck is Lyme's disease?
So Lyme's disease is an infection that we can acquire, as far as we know, only one way, and that is from the bite of a particular type of tick. And the particular type of tick that can actually bite you and transmit the infection to you is actually not found all over the United States or all over the world. So in the United States, we have many differing types of ticks. And in the North Carolina area, in the past, 10, 15, even 20 years ago, you had very little to a rare case of Lyme disease. But as with many infections that are emerging, what we have seen over the last number of years is we're starting to see more and more of these tick-borne related infections, Lyme being one of those, in areas of the country that previously we did not see it. And certainly in this area where we are here, we are starting to see more and more Lyme disease. And the reasoning for that is twofold. I think one, the tick population itself is changing and it's migrating, and we're seeing more of the particular type of ticks that transmit the infection here in the area. But also, we have started with awareness with conversations as we're having now. As providers start thinking more about Lyme disease, they actually think of testing, and they think of putting it in on their list of things of when someone comes in, should I be thinking about this tick-borne disease? So we're testing more for it, and we're more attentive to it. So I think the reason that we're seeing more of it now is twofold. More ticks are infected with Lyme, more ticks are in the area, and then we're actually testing for it and thinking about it more often. So Lyme disease is an infection that you acquire after a tick gets onto your skin, and it has to attach to your skin. And it really should be on your skin for at least 24 up to 36 hours. And then after it attaches to your skin, it takes a blood meal. It actually attaches and to the skin, and then it will eventually fall off. The difficulty is oftentimes that whole process can happen and you are completely unaware that it's occurred. So the tick gets on you, attaches, takes a blood meal wherein it can infect you, and then it falls off and you have no idea that it was even there. So what happens after that is many individuals, that scenario will occur, and they may have a day or so where they just don't quite feel themselves. They may feel more fatigued or just not quite right, but then their immune system kind of clears it all up and they go on and have no idea that they actually had Lyme disease. Other individuals will have that very same scenario occur where the tick attaches and then falls off, and they may or may not have seen it, and then a few days later they start feeling kind of like a flu-like illness, where there's a kind of a non-specific, I just don't feel well. They may have some shakes and chills, nausea, headache, aching, just generally not well. Oftentimes we in infectious disease like to call it, it's if you have someone who comes to you in the middle of the summer and they say, I think I have the flu, we should be thinking, if they're in an area, part of the country where there's Lyme disease, we should be thinking of a tick-borne disease, because that's exactly how it can start. So when you come in with that particular presentation and if your provider is thinking Lyme disease, unfortunately drawing a blood test, which is how we test for it, that blood test will be negative in the first several weeks of the infection. So that's not exactly very helpful.
Well, that's a bummer.
Yes, so a lot of people don't know that, and so we see people that are frustrated that they'll say, I went to the emergency department, I went to my primary care, and they didn't even test me for Lyme. And so I try to say to them, well, if you really had the history of the tick just having been on you or just being sick in a few days, the likelihood of the test being positive is exceedingly low. So the test doesn't really become positive until you're several weeks out, which goes back to then the provider, the practitioner, the physician, whomever is seeing you, really has to have a high index of suspicion and has to be thinking about the tick-borne disease, because they have to look at you, hear your story, believe that that's what it is, and initiate treatment if they think that you need to have an antibiotic treatment, because it's more of what we call a clinical diagnosis when you come in early on in the phase, because the blood work will not necessarily be helpful. So that's how most people present, is with a flu-like illness, but the only way to really get it is to have had the tick. Now, it would be nice if everyone would notice the tick, but unfortunately the ticks are so very small not much bigger than if you take the end of an ink pen or an end of a pencil and the very tip of it. They're just really not much bigger than that. So they can get on your skin, particularly on the nape of your neck or behind your ear or the back of your leg. And you may, even when you go in and shower, you may not even notice that that tick is there. So they're very difficult to see. So I would say the majority of people that I see with Lyme disease do not even remember seeing a tick on their skin.
Yeah. Mm-hmm.
So making it more difficult if someone comes in with that same scenario, flu-like syndrome, aching, headache, low-grade fever, not feeling well, and we say, did you see a tick? If the patient says, I've never seen a tick, we still can't fully rule out considering Lyme disease because they may not have seen the tick.
Right, right.
Yeah.
So there's a lot of long-term effects, though, from Lyme disease, too, isn't there?
There can be, and we think it's probably underscored a bit. There are probably a lot of long-term effects that we just really have not fully identified yet. So the real question is, what if I have Lyme disease and no one, myself or my provider, notices it and I don't get treated? Could there be long-term consequences? And to your point, which is a very valid point, there can be some long-term consequences. The ones that we tend to see the most commonly actually is arthritic complaints. People that have a somewhat sudden, unexpected progression in arthritis. We should be thinking if they're in a region of the country that have a lot of ticks, or they are in an occupation where they're outdoors and the likelihood of getting a tick, having had a tick exposure is high, we should be thinking of the possibility of them having had or having Lyme disease. So the long-term effects can certainly be a very progressive arthritis that can be very severe in many individuals. One of the most commonly talked about complications that we worry about is the cognitive deficits that can occur, the neurologic manifestations. People refer to brain fog or just not quite being on my game since I had Lyme disease, and so those can be concerns that are very difficult to measure. Oftentimes it will be the family that notices changes in the individual's personality or their ability to handle stress. Some of the long-term effects of Lyme can be an emotional irritability where they say, I just don't have the patience to do things like I did before. And it's because there's that central nervous system irritability that can occur when you have an infection with Lyme that's not adequately treated and addressed.
Mm-hmm. Yeah, it's, I see it. Is there a typical, if they are bitten, is there like a bullseye or anything like that? Or maybe not?
There can be. The question was, do all individuals who have Lyme get a bullseye rash? And that is the classic, the technical term is called erythema migrans, but it's a classic rash, a red rash that tends to have like a red circle, and then the center portion of it can actually become lighter. But again, that even though that's a common rash with Lyme, you can have any different rash with Lyme. But if you have if a patient comes in and says, I had a bullseye rash, or they show it on their phone and you see it, sometimes it's very classic for having had a tick exposure. Unfortunately though, only about 50 to 70% of people will present with a rash. So it would be nice if everyone who had Lyme disease had a rash, because that would be a nice way for people to diagnose this, but not everyone gets a rash.
Right, yeah.
And it can be multiple circles. It can be one isolated rash, or it can be, I've seen people with as many as 30 or 40 bullseye rashes covering their whole body when it's very severe.
Wow. Yes. And so the treatment is antibiotics, is that correct?
It is. The treatment is antibiotics, and it's fortunately it's very common antibiotics that we use. Lyme disease to date we've not discovered that it has become resistant to our antibiotics, which is fortunate. The type of bacteria that it is, we do have a few antibiotics that we feel are the most efficacious and the best ones. The most common one is doxycycline, which is a very common antibiotic that is used. And it is actually the drug of choice to be used for not just Lyme, but some of the other tick-borne related infections. And the majority, despite what some people will read, oftentimes people feel that the treatment of Lyme disease needs to be a very complex combination of antibiotics, but actually the number one and most efficacious treatment for Lyme disease is doxycycline, which is an oral antibiotic. And it's a relatively short course, as short as 10 days or up to 30 days, depending on how you present. So it's not months and months of antibiotics, and it's not multiple antibiotics. It's a very simple regimen. If an individual has an allergy to doxycycline, we do have a few other options, also very common antibiotics that are also effective, one of which is amoxicillin, which is a type of penicillin, so also very effective for Lyme disease. And then there's a cefuroxime, which is an additional antibiotic. So we do have a couple different antibiotics that we can use, and oral therapy or pill therapy has been shown to be exceedingly effective early on in the course of things.
Yeah, I normally will write for Doxy if the suspicion is there.
Yes.
And I tell them I don't know. There's no way to know.
Right.
I always get a test.
Yes.
They're always negative. Now
Yes.
I've found out they're going to be negative for the first few weeks.
Yes.
So
Yes.
I'm wasting some lab money there, I guess. But that's why I love this job. You learn something new every day.
We all do.
Yep, that's exactly right.
Absolutely.
That's exactly right. So I guess the key to prevention is, long sleeves, long pants, boots, that kind of thing. But
Absolutely.
when you want to go hiking and it's 95 degrees outside,
very difficult.
That's not your typical garb.
It is, and there are a lot of things that we can do that really doesn't require a lot except just planning ahead. I tell people when you're in those high-risk months, and the high-risk months are really when you're going to be outdoors, when you're going to be raking, working in your flower bed, working in your garden, going on hikes, sitting on your porch in the evening, sitting by a fire in the fall, raking leaves in the fall, anything that really you're outdoors for any degree of time, that's when you're going to be at the highest risk. But a couple of things I always remind people to do is, you're outside doing your thing and then you come inside, it's easy to get a drink of something and get a bite to eat, you sit down, you watch TV, read a book or whatever. If you're in an area where there's a lot of Lyme disease, or you're that individual who feel that you do see a lot of ticks crawling around, or you have yourself removed a tick from the skin and you're aware of it, getting into the habit of as soon as you come indoors and you've finished your outdoor activities, making sure that you just go take a shower. That will really help significantly, because if that tick is not attached yet, it will come off in the shower. So not delaying showering, or with children, I really encourage parents, particularly in the summertime when kids have been outside playing and it's dark and they come in, they may wait a few hours to bathe them. I say put them in the bath as soon as they come in, so that the likelihood of there being a tick, you can actually have the tick removed. So the long sleeves certainly are of benefit, but as you mentioned, it's difficult when it's hot. We do recommend some topical treatments that you can use, particularly if you're going to be out doing a project, like a big project in your yard, and you're going to be exposed to tall grass or leaves or whatnot. You can use a DEET-containing product. That seems to be very effective. And then there are some other alternatives. The oil of eucalyptus is another. There are a lot of products out there that are more natural-based products that people like to use. And then one of the things that people oftentimes are not aware of that I think is important, I don't know if people know that there are clothing items that you can purchase that are actually impregnated with a chemical that actually is a deterrent to ticks.
I did not know that.
Permethrin is the medication, and you can purchase those, and you can treat, if you're going camping, you can treat your sleeping bags. They also online in different places you can purchase long sleeve like flannel wear. So a lot of farmers who have had Lyme infection time after time after time, when they're seeing me, I usually recommend that they consider purchasing some of these impregnated clothing items. And you get your jacket and you hang it up on the hook in the barn, and so when you're going out to do whatever in the field, you put that jacket on. And so if you're not remembering to put the spray on, you at least have a clothing item that has something to deter
That is
ticks.
Awesome. And I guess you get it on Amazon. You can get everything on Amazon, right? The world runs on Amazon these days. That's for daggone sure. Anything else about Lyme disease we need to tell our folks tonight?
I think just having an awareness of it is very important, and it is. I think the takeaway is we are seeing it here. One of the big takeaways is making sure that you understand that there's not great testing for it, modalities, and really the diagnosis is a clinical diagnosis when you're sick. So be seen and just be aware, and then all these things in terms of prevention, I think, really go a long way. And really just assess what you're going to do and try to lower your risk. Lyme disease can have multiple ways that it can present. Probably some of the questions I get asked occasionally is, what is the most severe case of Lyme disease that you've ever seen? Lyme disease, most cases we see are relatively mild, treated with a short course of antibiotics, no long-term problems. But the long-term problems that we alluded to can be the arthritis that can progress. You also can have a meningitis, and that's very severe, and hopefully that individual would present to an emergency department. Very high-grade fever, stiff neck, confusion, feeling poorly. But also the Lyme infection can infect the electrical conduction system in your heart, and you can develop basically a heart block, which the way that would present is you start passing out. You have an unexplained fainting, multiple episodes of fainting, and you come into the emergency department and we hook you up to a monitor and you have heart block.
Wow.
In someone who's never had any cardiac conditions.
I've never
so
known
that can be a Lyme infection. So the reason I bring that up is just that Lyme is more than just an inconvenient illness that you get and feel poorly for a while. And there's no way to really predict if both of us have Lyme. I can't predict which one of us is going to have one of the really mild cases or who's going to have another case. And then probably can't talk about Lyme without reminding people that unfortunately, when you get Lyme disease, unlike many infectious diseases that once you get them, you are immune to them and you don't get it again, Lyme disease, once you recover and treated or not treated, once you recover from Lyme, you unfortunately can get Lyme multiple times. So once having had Lyme does not render you immune to Lyme in the future. So that's very important.
Well, that stinks too, doesn't it?
Yeah.
There's just no good news about that other than for most people it's a pretty mild infection.
Yes.
Yeah.
And thinking about your pets, everyone has pets, so some people say I don't have to worry about Lyme. I'm an indoor person. I don't like to go outside. I don't like to do those things. And then I'll say, do you have animals? Oh, yes, I have dogs. I have cats. Do they sleep with you? Yes. So even though we treat our animals at the vet, and many of the treatments, the ticks will fall off of them, remembering if they're sleeping with you or on your sofa or sitting on your lap and they bring the ticks indoors and the tick leaves their skin, it can easily attach onto you. So you don't really have to be an outdoor person to be exposed to Lyme. Wow.
Well, there you go. Everything you ever wanted to know or not know about Lyme disease. So it's time for our next break. Just hang on, and when we come back, I don't know what we'll talk about. Maybe some flu. Okay. See about that, and just some. There's simple infections too that Dr. Smith probably doesn't treat too much, but we'll talk about some things that are out there that we can be cognizant of. And I think one thing I'd like to touch on a little bit when we come back is overuse of antibiotics.
Yes.
Because this is flu season, this is cold season, everybody wants an antibiotic, and
Absolutely.
and why we should not always have that. Maybe we'll talk on that a little bit. All right, don't go away. We'll be right back. Hang on.
When Jay arrived at the emergency department with a hernia, he was in pain, scared, and unsure of what would happen next. That's when he met Dr. Clarice Monnier.
The way she conveyed, it was something that I could understand. She didn't talk over my head. She called me at home on her cell phone just to see how I was doing. They really treated me like family. I just can't say enough, and I wouldn't be hesitant to come back here.
Learn more at nashsurgery.com.
We're in our 18th year of practice at the Hammer Chiropractic Center, and we've seen over 15,000 different people in the Rocky Mount area. 40% of headaches actually come from a neck problem. Many patients come in taking multiple aspirin, over-the-counter medications and such a day, and we can get you to stop doing that and actually fix the problem so the headaches don't rise anymore. A lot of people think chiropractic hurts. It does not. Most of the people come in and they feel great when they leave.
When faced with special care needs for elderly or disabled loved ones, families want compassionate, comforting care. That's Tender Touch Home Care Services' goal, providing the level of care we would expect for our own. With over 10 years of home care excellence, Tender Touch provides an array of services that keeps your loved one at home. From personal care, light housekeeping, errands, and meal preparation, to our private duty care program, which combines all of our home care offerings in one package.
Tender Touch Home Care Services, where your needs are our concern.
All right, welcome back. I'm here with Dr. Connie Smith. She's an infectious disease specialist working at UNC Nash, and she is new to our area, so if you see her out and about at the farmer's market, although I guess those days are about over for this season, but if you see her, be sure you say, "Hi, I saw you on Linda's show," because I think Dr. Smith wants to integrate herself into our community, and I'm very excited about that. And so we are going to continue talking about infectious disease. We talked a little bit about her and how she got here and what she does, and we talked primarily about Lyme disease because that's a kind of a big deal. And now I think we're just going to talk about some generalized infections and things that are not necessarily that would require your expertise. But what is the most prevalent, common thing we can all do to prevent infectious disease as much as possible?
That's a great question, and I think sometimes we need to put more emphasis on some of the things for prevention instead of so much emphasis on treatment. So
yes.
I'm glad that you led in with that particular thing. And I know everyone has so much COVID fatigue from hearing about COVID virus, but I think we did learn a lot from when we had the COVID infection in this country. And one of the things that those of us who were on the front lines in terms of actually seeing patients coming in, even before we had vaccines or before we really had treatments that we knew worked for COVID, and it was a new virus for everyone. One of the things that was really striking to me, seeing patients in the ICU and clinic and even in the community, friends, family that had it, one of the common things that I felt that I saw that was very striking was the individuals who seemed to struggle the most with getting over COVID were those individuals who were not exercising, were not really properly taking care of themselves. And really, it wasn't that they just didn't want to, but many individuals were just so busy with other things, with work or whatever, that they really had lost focus on what it means to get adequate rest, exercise, maintain a healthy weight, really looking at your diet, what types of things. So to your question, I think what can we do, particularly leading into a respiratory season now where we know there's going to be influenza. We've already started to see a little bit of the influenza. We know COVID is still out there, different strains all the time changing. It's probably never going to go away. It's just going to look a little different when we see it. Sometimes it'll be more severe, sometimes it'll be less severe, sometimes we won't even make you stop in your tracks. It'll be a runny nose for a day or so. But I think one of the biggest things that I would want to emphasize is the immune system and how connected our immune system is with our vulnerability to picking up infections. So I think if I could tell you one thing that you could do in this respiratory season, particularly in the respiratory season, is this is that time of the year where if you're not already doing something for yourself every day, if you're not doing that 15 to 20 minutes of walking or exercise of some sort, where you're really forgetting everything else and you're just exercising, you're moving, you're getting up, you're going outside, you're walking around the block, you're going to the gym, or just taking a walk in your neighborhood, whatever you're doing, but you're doing something. And then really looking at critically at your own diet yourself and saying, am I eating healthy foods, or am I really eating lots of things that I know are not good for me, and I keep thinking I'm going to make a change and I haven't made the change. I will tell you, the people who again struggled the most with getting over the COVID infection tended to be people who had uncontrolled blood sugars with their diabetes. Their weight was more than it should be that was adequate, and they had excessive levels of just stress in general because they weren't taking a proper care of themselves. So I think that's one thing, and that does strengthen your immune system. People don't realize, but getting into a habit of walking every day is strengthening your immune system. Eating properly and getting adequate sleep at night is absolutely helping your immune system. And we tell people that when they're healing from severe infections that they almost died from, and we say when they leave to go home, it's very important to have adequate help at home. And they'll say, why do I need help? I can do all this myself. And I'll say, I don't want you to be stressed. I want your stress levels to come down. I want you to be eating properly. I want someone to be thinking about the meals that you're eating so that you have a well-rounded meal and you're not, trying to struggle on your own and you just eat something quick that's not healthy. So that's one of the things I think we can do. And then we're in flu season, so I would be remiss if I didn't say the flu vaccine has been shown to be effective in the sense that if you have had flu vaccine, the likelihood of you, when you get flu, the likelihood of you doing poorly is much less if you have had the vaccine. The vaccine doesn't mean that you're never going to get flu. I mean, sometimes the strains don't match up, or maybe I get the vaccine and the strain matches up that year, but my immune system, for whatever reason, the day I got the vaccine, just simply didn't work with the vaccine and I didn't get the protection. So even as an infectious disease doctor, there have been years where I've gotten the vaccine and I still have flu. And people say, well, then are you not going to get the vaccine again? And I say no, because I didn't die from flu. So, and maybe I would have if I wouldn't had the vaccine. So if you're someone who would be accepting of getting a vaccine, I think that is definitely a prevention that really would be to your advantage to have the influenza vaccine. Again, not saying you're never going to get flu if you get the vaccine, but it's going to give you some immunity ahead of the game so that if you do get influenza, you have some immunity. So I think that vaccine is actually a helpful thing as well. And then some of the other things is just being smart about it. If you're going to go into a crowded area in the middle of winter when you're hearing about influenza on the news, be smart about it. It may be that if you are not feeling so great or you have something coming up that you really can't be ill for, you say, I'm not going to attend this event because the risk of me being around someone and picking up flu, so I'm going to sit this one out. So I think just being aware. And then I can't say enough about hand washing. We talk about hand washing all the time, and it seems so silly, but it's really crazy when we have done studies and we actually watch people. We think everybody washes their hands a lot, but they really don't. So again, just can't say enough about thinking those small, simple things can make such a big difference.
Right. Are there any, and I totally agree with eating right and exercising. I get on my soapbox, and anybody who watches me knows I'm on my soapbox every week. You can't expect, and of course, people want weight loss. Well, they're going to go through the McDonald's and then walk for 20 minutes and say, I walk every day, I don't lose weight. Well, you're not going to. You've got to eat healthy foods. You've got to cook. Yes. You've got to cut those vegetables up. You've got to, learn how to eat that way. And I don't like to cook every day, and I don't like to get up and exercise every day, but I do. Yeah. Because I know that that's what I need, and I've worked in medicine for 35 years or so, and I'm very fortunate that I have a very high immune system. I don't get sick very often, and I'm grateful for that. But I work on that too. But do you think there's any particular supplements or should we eat an orange every day for the vitamin C? Or do you think there's things on the market that we could use as well as our other hand washing and eating right and exercising? Yeah,
I do think as much as there are supplements out there to take, I think to your point, avoiding some of the things that we know are really difficult for our immune system to handle, I think. But from a supplement standpoint, the vitamin C, the fresh fruits, the fresh vegetables, they have so many good things in them that people will say, what's the best vitamin to take to ward off infections? And there are a lot of things that people do. Extra vitamin C, if you're feeling like you may be coming down with a cold or something, there's some herbal products. Again, these things aren't tested in the way that our other medications are, but I do think there are definitely benefits to some of those things. So I think you made a great point. Going back to being okay with preparing some of your food and thinking about what you're eating is a big thing, and just making sure that you are truly hitting all of the different things in your food group and not just doing one particular thing. Staying hydrated, we can't speak of that, I think, probably enough. So many of us walk around and we don't hydrate well, particularly in the winter. And again, with COVID, one of the biggest reasons people ended up in the emergency department and then they would get discharged home is they would become exceptionally dehydrated when they would have a viral infection. So if you are coming down with whether it's influenza, COVID, or you don't know what it is, but you just know something has hit you, you're coming down with something, I think taking that time to just sort of stop, regroup, making sure you're hydrating really well, that should be the time when you really limit your high carbohydrate, sweet, sugary things, and you really focus on healthy diet, because I'm really trying to fight off an infection. So I think that's more than a particular supplement to take.
Yeah. I pretty much thought that, but never hurts to ask.
Yes, absolutely.
Yeah, I haven't seen too much flu. I know it's out there, but
yes, we're seeing some, not a lot yet, but it will come. But we'd see it kind of in pockets at first, and when it gets cooler and people are congregating more in indoor venues, we'll start to see it more.
Right.
For sure.
Right. Yep. Yep. Now, is there anything else we need to touch on? I know you've got something in that pretty brain of yours.
I can't think of. We talked about the emerging tick illnesses heading into respiratory season. We also, RSV is another virus that's out there, and I think someone maybe later will be talking about RSV, but it's a respiratory virus. It's not new. It's been around for a very long time. What is new with RSV is we do now have the availability of a vaccine that's been out for a while for adults. For many years, we only had those types of treatments for the pediatric population, but we have them now for adults. And so people may say, well, do adults really need to have it? And I think, again, it's on a case-by-case basis. If you're a grandparent and you watch your grandchildren a lot, the likelihood of you picking up a respiratory virus such as RSV is pretty high. If you are in good shape, good health, no chronic medical conditions, you may be able to have the infection with RSV and do very well. A few days of feeling poorly and you're right back to work, no problem. But if you have diabetes or heart disease or lung disease, a virus like RSV, even though it's been around for a very long time, if you were to acquire that, you could become very ill. And then the thing we have to think about is when you have a virus like influenza, COVID, RSV, or the common cold, if you're not in great shape or you're not handling it well, you then can develop a secondary infection with the bacteria. And we do see that. The main reason adults get admitted to the hospital with influenza typically is because they develop an influenza post-bacterial pneumonia. So I think that's one of the things just to remember is if you have influenza and you feel like you're over it, but it seems to be lingering far longer than what you remembered it did in the past or far longer than any of your friends that have had it, I urge you not to stay at home and ignore it, but to make an appointment with your provider, because it could be that you are developing a post-influenza pneumonia that would need to be treated differently. And then we always, this time of the year, we think about reminding individuals that viral infections do not respond to antibiotics. And even though you can develop a bacterial infection after a viral infection, the majority of people do not need an antibiotic when they have a viral infection. And there are some downsides to taking antibiotics when you don't need them. It's very easy. One of the things I like to say about my line of work is it's very easy to give an antibiotic. Sometimes the hardest part of my job is to explain to other providers or patients why they don't need an antibiotic. Because we do have a problem, not just in the United States, but all over the world with increasing resistance. And we don't have a ton of antibiotics that are constantly coming out and being developed. So really only utilizing those antibiotics in times where it's felt that they're necessary is very important. There can be complications of overuse of antibiotics, not to mention selecting out a resistant bacteria so that later when you come in, you have an infection and we have to say to you, we don't have any antibiotics to treat you because everything we have you're resistant to. but antibiotics can have complications. There can be life-threatening diarrheas that occur,
Yes, that's
diarrheal infection, a diarrhea that happens as a consequence of taking an antibiotic. And it can be something simple like 3 days of amoxicillin, and you can develop something called C. difficile infection, which can be life-threatening. So that's one of the other things we really try to educate people and help people navigate through when they need an antibiotic.
Wow. Well, we could go on, but unfortunately our time is up. So we appreciate you watching. Thanks so much. Thank you, Dr. Smith, for
You're
coming.
quite welcome.
I really
Thank you for having me.
appreciate it. And we will see you next week with more of Here's to Your Good Health. Good night.